Order. The Honourable Member for Halifax.
Mr. Speaker, the Conservatives have reached new heights of irresponsibility by giving the unelected Senate the mandate to review the 2004 Health Accord. The Accord should be reviewed by the House of Commons Standing Committee on Health, not by the Senate. Mr. Speaker, why do the Conservatives want to prevent elected representatives from reviewing an accord that is so important for all Canadians? The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, our government is committed to a universal and public health care system and committed to Canada's Health Act. Unlike the previous Liberal government, we won't balance the budget on cutting health care, and we continue to work with the provinces and the territories and healthcare professionals to look for ways to improve healthcare system. And earlier, 2 weeks ago, I sent a letter to the Senate committee's co-chairs requesting them to undertake a review of the Health Accord and report back the work accordingly. Thank you, Mr. Speaker.
The Honourable Deputy.
The Honourable Member for Halifax.
That was stunning. Let me try again. The Canada Health Accord is up for mandatory review, and this government has decided to bypass the elected House and instead ask unelected senators to do the review. It's undemocratic and irresponsible. They refuse to start public consultations on the next accord, and they're using their unaccountable Senate majority to bury the official review of the last accord. Mr. Speaker, will the minister withdraw this request of the Senate and hand it over to the elected members of Parliament where it belongs?
Yes. The Honourable Government House Leader. Order.
Listen, Mr. Speaker. We've asked the Senate to look into this issue. The House Health Committee of Elected Representatives is certainly free to look into any matter it wishes. We have a minority on that committee. One of the things that is important with respect to healthcare, it's this government which, instead of cutting healthcare by $25 billion like the previous government did, has increased healthcare spending by 30% from the federal government, and that's a great accomplishment, Mr. Speaker.